Hi, my name is Dr. Beth Hart. I'm a general pediatrician. I've been practicing for 27 years. I work at Medical Center Hospital at the JBS Healthy Kids Clinic, and this is Ask a Doc. What are the most common childhood illnesses and conditions that parents should be aware of, and what are the recommended preventative measures? The most common childhood illness is, of course, some sort of viral illness. And the most common way that a child gets a viral illness is from going to daycare. So children in daycare, they say, have about 12 respiratory infections a year, most of which are mild viral illnesses that are easily cured by just really a little Tylenol, Advil, and a tincture of thyme. All right. What vaccinations are crucial for children and why? And are there any recent updates or changes to the immunization schedule that parents should be aware of? I think vaccinations are very important. We can only look at the fact that there are certain vaccine-preventable illnesses that are no longer with us. I don't know really anybody that has polio. I don't know anybody that has smallpox. With vaccines, I think we cure disease. I encourage parents to vaccinate their children, but in the end, that's a very personal decision that a parent has to make. I think vaccines are very safe and very effective. Are there any updates to the vaccine schedule? There are. In fact, in June of this year, the FDA just approved an RSV vaccine for infants. RSV is a very common childhood illness that causes morbidity and mortality, or causes hospitalization and death in infants. Each year, about 80,000 children under the age of 5 are admitted to hospitals for RSV, and about 300 of those die. So it's an important vaccine that we're about to initiate. It's given to infants under 24 months, now entering the winter months where RSV is common. How can parents ensure their child's healthy growth and development, both physically and mentally? I think what I try to do as a parent every day is nurture my child, love my child unconditionally, and give him a supportive environment. I try to spend time with him, get to know him. When he was younger, I went to his school. I got involved in his classes. I got to know his teachers. I got to know his friends, and I got to know his parents' friends. And I think that's important as they grow up, and you mold them into, you try to mold them into being a responsible, happy individual. Next question. Are there any specific milestones or red flags that parents should watch out for? I think anytime a parent is concerned about something, I always encourage them to come in and talk to me. I always have time for them. I'll make time for them. Even if it is nothing, it's not a waste of my time. If the parent is concerned, then it's something that I should be concerned about. So specifically, are there red flags? I think that's a generalization, but what I really want to emphasize is that if a parent is concerned about something, I'm concerned about it. Let's see. What strategies or tips can you provide to parents to help manage common childhood issues, such as sleep habits, picky eating, or behavioral challenges? So, a lot of sleep problems in children are born out of habits that are started in infancy. So setting good sleep habits in infancy, not rocking babies to sleep, not feeding them until they're asleep, but kind of allowing them to develop their own self-soothing mechanisms. So really setting good habits in infancy can lead to good habits in childhood. The other thing is, I think, be consistent. So sometimes there's one parent, and sometimes there's two parents, and sometimes there's grandparents involved. And I think the whole family needs to get together and be consistent in and how they parent that child, because if a father and a mother disagree, it's going to confuse the child and lead to kind of behavioral problems later on. The other thing is, try not to yell at your children. That's sometimes very difficult. Even as a parent myself, I find myself sometimes wanting to yell at my child, but children don't respond to that very well. In fact, it kind of makes them back away from us and what we're asking them to do.